Question 1. The efficiency study reveals that many homeobotanical therapists struggle to balance comprehensive client record keeping with the demands of a busy practice. Considering the regulatory framework and ethical guidelines for homeobotanical therapists, which of the following documentation practices best upholds professional standards and ensures client safety and continuity of care? Option A. Documenting only the client's name and the date of consultation, assuming that the practitioner's memory is sufficient for recalling treatment details. Option B. Maintaining detailed records of each client consultation, including a thorough history, presenting complaints, practitioner's observations, specific homeobotanical remedies prescribed, including potency and frequency, and the client's reported response to treatment. Option C. Keeping records that focus primarily on the financial transactions with the client, with minimal information about the therapeutic interventions provided. Option D. Relying on brief, generalized notes summarizing the client's general condition and the broad category of remedies used, without specifying exact potencies or frequencies. The correct answer is B. Maintaining detailed records of each client consultation, including a thorough history, presenting complaints, practitioner's observations, specific homeobotanical remedies prescribed, including potency and frequency, and the client's reported response to treatment. Explanation. The efficiency study reveals a common challenge in homeobotanical practice: balancing thorough client record keeping with the time constraints of a busy practice. Maintaining accurate and comprehensive documentation is paramount for several reasons. Firstly, it forms the legal and ethical foundation of the therapeutic relationship, providing a record of the client's health status, the practitioner's assessment, the remedies prescribed, and the rationale behind those choices. This is crucial for continuity of care, especially if the client sees another practitioner or if there are any future inquiries or disputes. Secondly, detailed records allow for effective tracking of treatment progress, enabling the practitioner to assess the efficacy of interventions and make informed adjustments. This is not only good practice, but also essential for demonstrating professional competence and adherence to standards of care. The correct approach, which involves meticulously documenting each consultation, including client history, presenting complaints, observations, the chosen homeobotanical remedies with their potencies and frequencies, and the client's response, represents best professional practice. This aligns with the core principles of responsible practice, ensuring accountability, transparency, and the ability to provide evidence-based care. Such thoroughness is implicitly or explicitly required by professional bodies and ethical codes governing complementary health practitioners, emphasizing the importance of a clear and auditable trail of all therapeutic actions. Incorrect approaches, such as relying on brief, generalized notes or omitting details about specific remedy selections and dosages, pose significant professional and ethical risks. A failure to document specific remedy details could lead to accidental duplication of remedies or contraindications if the client consults other practitioners. Furthermore, vague records make it impossible to objectively assess treatment effectiveness, potentially leading to prolonged or inappropriate treatment. Ethically, such omissions can be seen as a breach of duty of care, as they compromise the practitioner's ability to provide safe and effective care and to defend their professional actions if challenged. Legally, incomplete records can be detrimental in cases of malpractice claims or regulatory investigations, as they fail to demonstrate due diligence and adherence to professional standards. The professional decision-making process for similar situations should involve prioritizing the client's well-being and the integrity of the therapeutic relationship. This means recognizing that while efficiency is desirable, it should never come at the expense of comprehensive and accurate record-keeping. Practitioners should develop systematic methods for documentation, perhaps utilizing templates or digital record-keeping systems, to streamline the process without compromising the quality of the information recorded. Regular review of one's documentation practices and seeking feedback from peers or professional bodies can also help ensure adherence to best practices. Question 2. Investigation of a client's request for a specific herbal preparation, which they believe will address their chronic fatigue, requires the homeobotanical therapist to consider various approaches. The client has read about this preparation online and is insistent on its use, despite the therapist's initial assessment suggesting a different botanical approach might be more suitable based on the client's overall symptom picture and constitutional type. Which of the following represents the most appropriate best practice for the therapist in this situation? Option A. Recommend the requested herbal preparation without further investigation, assuming the client's online research is valid and will lead to a positive outcome. Option B. Thoroughly assess the client's overall health and the specific indications for the requested preparation, discuss the potential benefits and risks with the client, and collaboratively decide on the most appropriate therapeutic plan, which may or may not include the requested preparation. Option C. Politely decline the client's request and insist on prescribing the remedy the therapist believes is more suitable, explaining that the client's online research is likely inaccurate. Option D. Immediately prescribe the requested herbal preparation as the client is adamant about its use to ensure client satisfaction and maintain a positive therapeutic relationship. The correct answer is B. Thoroughly assess the client's overall health and the specific indications for the requested preparation, discuss the potential benefits and risks with the client, and collaboratively decide on the most appropriate therapeutic plan, which may or may not include the requested preparation. Explanation. The scenario presents a common challenge for homeobotanical therapists, balancing the client's expressed preferences with the therapist's professional judgment and adherence to established principles. The challenge lies in discerning when a client's request aligns with safe and effective practice, and when it might indicate a misunderstanding of homeobotanical principles or potential risks. Careful judgment is required to ensure the client's well-being and maintain professional integrity without alienating the client. The correct approach represents best professional practice because it prioritizes a thorough understanding of the client's condition and the rationale behind their request before making any therapeutic recommendations. This aligns with the core homeobotanical principle of individualized treatment, which necessitates a deep dive into the client's unique presentation. It also upholds the ethical obligation to provide safe and evidence-informed advice, even if that advice deviates from the client's initial suggestion. By educating the client and explaining the therapeutic reasoning, the therapist fosters trust and empowers the client to make informed decisions, which is a cornerstone of responsible practice. An incorrect approach that blindly follows the client's request without proper assessment fails to uphold the principle of do no harm. It bypasses the crucial step of evaluating the suitability and safety of the proposed remedy for the client's specific situation, potentially leading to adverse effects or ineffective treatment. This demonstrates a lack of professional diligence and a disregard for the foundational principles of homeobotanical therapy. Another incorrect approach that dismisses the client's request outright without adequate explanation or exploration of their reasoning can be perceived as arrogant or dismissive. While the therapist may have valid concerns, failing to engage with the client's perspective can damage the therapeutic relationship and prevent the therapist from uncovering underlying issues or valid reasons for the client's preference. This approach neglects the importance of client-centered care and collaborative decision-making. A third incorrect approach that involves recommending a remedy based solely on anecdotal evidence or popular opinion, without considering the client's individual needs or the established principles of homeobotanical therapy, is professionally unsound. This can lead to inappropriate prescribing and a failure to achieve therapeutic goals, undermining the credibility of the therapist and the practice itself. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Active listening and information gathering. Fully understand the client's request, their perceived benefits and their underlying rationale. 2. Assessment and diagnosis. Conduct a thorough assessment of the client's health status, considering all relevant factors. 3. Principle-based evaluation. Analyze the client's request in light of established homeobotanical principles, safety guidelines, and contraindications. 4. Informed recommendation. Formulate a recommendation based on the assessment and principles, clearly explaining the rationale to the client. 5. Collaborative decision-making. Engage the client in a discussion about the recommended course of action, addressing any concerns and ensuring their informed consent. 6. Documentation. Meticulously document the entire process, including the client's request, the therapist's assessment, the rationale for the recommendation, and the client's decision. Question 3. The investigation demonstrates that a homeobotanical therapist is preparing a remedy from a tough, woody root known for its potent constituents that are best released through prolonged heat, Which extraction method, when applied correctly according to Homeobotanical therapist certification guidelines, would be most appropriate to ensure optimal therapeutic yield and safety? Option A. An expression, involving mechanically pressing the plant material to extract its juices. Option B. A decoction, involving simmering the root in water for an extended period. Option C. A maceration, involving soaking the root in a cold solvent for a prolonged period. Option D. An infusion, involving steeping the root in hot water for a short duration. The correct answer is B. A decoction, involving simmering the root in water for an extended period. Explanation. This scenario presents a professional challenge in ensuring that the preparation of botanical remedies adheres to established standards for efficacy and safety, as dictated by the Homeobotanical therapist certification framework. The core of the challenge lies in selecting the most appropriate extraction method for a given botanical material, considering its properties and the desired therapeutic outcome, while remaining compliant with regulatory guidelines. Careful judgment is required to avoid compromising the integrity of the remedy or misrepresenting its potential benefits. The correct approach represents best professional practice because it prioritizes the selection of an extraction method that is scientifically validated and aligns with the principles of homeobotanical therapy as outlined in the certification guidelines. This ensures that the resulting tincture, infusion, or decoction is prepared in a manner that maximizes the extraction of beneficial compounds while minimizing the degradation of active constituents. Adherence to these established methods is crucial for consistent product quality and predictable therapeutic effects, thereby upholding the professional standards of a certified homeobotanical therapist. An incorrect approach, such as using a method that is not suitable for the specific plant material or the desired outcome, represents a failure to meet professional standards. For instance, employing a simple infusion for a woody root that requires prolonged boiling decoction would result in an ineffective preparation, failing to extract the necessary medicinal compounds. This could lead to a misrepresentation of the remedy's efficacy and potentially harm the client by providing a suboptimal treatment. Ethically, this constitutes a breach of professional duty to provide competent and effective care. Another incorrect approach might involve deviating from recommended solvent ratios or extraction times without a clear, evidence-based rationale, potentially leading to inconsistent potency or the extraction of undesirable compounds, thus compromising safety and efficacy. The professional decision-making process for similar situations should involve a systematic evaluation of the botanical material's characteristics, e.g., plant part, cellular structure, solubility of active compounds, the intended therapeutic action, and the specific requirements of each extraction method, tincture, infusion, decoction, as defined by the Homeobotanical therapist certification guidelines. This involves consulting reliable resources and applying knowledge of phytochemistry and extraction principles to make an informed choice that ensures both the quality of the preparation and adherence to regulatory and ethical obligations. Question 4. When evaluating a client presenting with a chronic condition, which approach best reflects the understanding of vital force and homeostasis within the Homeobotanical therapist certification framework? Option A. Focusing exclusively on suppressing the most prominent physical symptoms to alleviate client discomfort, assuming that symptom relief will indirectly support the body's homeostatic mechanisms. Option B. Administering a broad-spectrum botanical remedy known for its general tonic properties, without a detailed assessment of the client's individual vital force or their specific homeostatic challenges. Option C. Prioritizing the identification and support of the client's vital force, recognizing that symptoms are manifestations of its disturbance and that restoring its balance will naturally guide the body towards homeostasis. Option D. Relying solely on standard physiological markers of homeostasis and conventional diagnostic criteria, disregarding the concept of vital force as it is not empirically measurable by allopathic means. The correct answer is C. Prioritizing the identification and support of the client's vital force, recognizing that symptoms are manifestations of its disturbance and that restoring its balance will naturally guide the body towards homeostasis. Explanation. The scenario presents a common challenge for a homeobotanical therapist, discerning the client's underlying vital force imbalance versus superficial symptoms, and understanding how this relates to the body's natural drive towards homeostasis. The The professional challenge lies in accurately assessing the client's vital force, which is a core concept in homeobotanical practice, and differentiating it from the body's attempts to maintain equilibrium, homeostasis, when faced with stressors. Misinterpreting these can lead to ineffective or even detrimental treatment. The correct approach emphasizes a holistic assessment that prioritizes understanding the client's vital force as the fundamental principle of health and disease, and then observing how the body's homeostatic mechanisms are responding to or compensating for any vital force disturbance. This aligns with the foundational principles of homeobotanical therapy, which posits that disease arises from a disruption of the vital force, and that the body's symptoms are expressions of its attempt to restore balance. By focusing on the vital force, the therapist aims to address the root cause, thereby supporting the body's natural ability to achieve homeostasis. This approach is ethically sound as it respects the client's inherent healing capacity and adheres to the therapeutic philosophy of the practice. An incorrect approach that focuses solely on symptom suppression, without considering the vital force, fails to address the underlying cause of the imbalance. This can lead to a masking of deeper issues, potentially hindering the body's natural homeostatic processes and leading to a chronic state of disease. Ethically, this could be seen as a failure to provide comprehensive care, as it prioritizes symptom relief over addressing the fundamental energetic disturbance. Another incorrect approach that dismisses the concept of vital force entirely and relies only on observable physiological markers of homeostasis would be a departure from the core tenets of homeobotanical therapy. While understanding homeostasis is important, within the framework of this certification, the vital force is considered the primary driver of health. Ignoring it would mean practicing outside the defined scope and philosophy of a homeobotanical therapist, potentially leading to a disconnect between the therapist's practice and the client's expectations based on the modality. A third incorrect approach that focuses on external botanical interventions without a deep understanding of the client's vital force and their individual homeostatic responses risks prescribing remedies that are not harmonically aligned with the client's unique energetic state. This can lead to a lack of efficacy or even adverse reactions, as the intervention is not tailored to the specific vital force disturbance and its impact on the body's homeostatic efforts. This represents a failure in personalized therapeutic application, a key ethical consideration in specialized therapeutic practices. The professional decision-making process should involve a thorough case taking that explores the client's history, symptoms, emotional state, and lifestyle, with a specific focus on identifying the nature and quality of their vital force. This assessment should then inform the selection of botanical remedies that are known to support and rebalance the vital force, thereby facilitating the body's natural return to homeostasis. Continuous observation and reassessment of the client's response are crucial to refine the therapeutic approach. Question 5. Risk assessment procedures indicate that a homeobotanical therapist is reviewing the historical development of their practice. Which approach best reflects a critical and evidence-informed evaluation of this historical context for contemporary application? Option A. Relying exclusively on anecdotal patient testimonials from historical records to guide current therapeutic choices, assuming past success guarantees future efficacy. Option B. Disregarding all historical practices and remedies as obsolete and unscientific, focusing solely on contemporary research without acknowledging any historical lineage. Option C. Accepting all historical claims of efficacy as inherently valid, given their longevity and the tradition they represent within homeobotanical practice. Option D. Prioritizing the systematic analysis of foundational texts and early clinical observations, cross-referencing them with modern scientific research and current regulatory guidelines to discern validated principles from anecdotal accounts. Correct answer is D. Prioritizing the systematic analysis of foundational texts and early clinical observations, cross-referencing them with modern scientific research and current regulatory guidelines to discern validated principles from anecdotal accounts. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a homeobotanical therapist to critically evaluate historical claims and their impact on current practice, balancing tradition with evidence-based understanding. The challenge lies in discerning between anecdotal historical accounts and documented therapeutic developments, ensuring that current practice is informed by a nuanced understanding of the field's evolution, without being solely dictated by potentially outdated or unverified historical narratives. Correct approach analysis. The correct approach represents best professional practice because it involves a systematic and critical evaluation of the historical development of homeobotanical therapy. This approach acknowledges the foundational contributions of early practitioners and the evolution of understanding regarding plant-based remedies within a homeopathically informed framework. It emphasizes the importance of discerning which historical practices have been validated or refined by subsequent research and clinical experience, aligning with the ethical obligation to provide safe and effective care. This aligns with the principles of continuous professional development and evidence-informed practice, ensuring that the therapist's knowledge base is current and robust, drawing from historical context while prioritizing contemporary understanding and regulatory compliance. Incorrect approaches analysis. One incorrect approach fails by uncritically accepting all historical accounts as definitive proof of efficacy. This represents a regulatory and ethical failure, as it bypasses the need for evidence-based validation, potentially leading to the use of ineffective or even harmful remedies based solely on tradition. It neglects the professional responsibility to ensure treatments are supported by current understanding and regulatory guidelines. Another incorrect approach errs by dismissing all historical developments as irrelevant due to a perceived lack of modern scientific rigor in their initial documentation. This is an ethical failure, as it disregards the potential for valuable insights and foundational principles that may have been refined over time. It also fails to acknowledge the historical context that informs the development of current therapeutic modalities, potentially leading to a practice that is disconnected from its roots and the accumulated wisdom of the field. A further incorrect approach involves prioritizing anecdotal evidence from historical texts over established scientific research and contemporary clinical guidelines. This is a significant regulatory and ethical failure. It demonstrates a disregard for the established standards of practice and the imperative to base therapeutic decisions on the most reliable and current information available, potentially jeopardizing patient safety and professional integrity. Professional reasoning. Professionals should approach the historical development of their field with a critical yet respectful lens. The decision-making process involves 1. Identifying the core principles and foundational theories from historical texts. 2. Evaluating these principles against current scientific understanding and evidence-based research. 3. Considering how historical practices have been modified or validated by contemporary clinical experience and regulatory frameworks. 4. Integrating historical context with current best practices to inform therapeutic decisions, always prioritizing patient well-being and adherence to professional standards. Question 6. Quality control measures reveal that a batch of botanical material intended for a specific homeopathic preparation has been identified and classified using a system that is not universally recognized within the Homeobotanical Therapist Certification Framework. This raises concerns about the accuracy and consistency of the ingredient. Which of the following approaches to resolving this discrepancy best upholds regulatory compliance and professional standards? Option A. Re-identify and reclassify the botanical material using a recognized botanical taxonomy system, cross-referencing with established pharmacopoeias and reputable botanical databases to ensure definitive identification and correct classification. Option B. Implement a new, internally developed classification system based on the observed characteristics of the plant, to be used exclusively by the practice. Option C. Discard the batch of botanical material without further investigation, as any deviation from standard practice introduces unacceptable risk. Option D. Accept the existing classification as sufficient, assuming the therapist's personal experience with the plant is adequate for therapeutic use. The correct answer is A. Re-identify and reclassify the botanical material using a recognized botanical taxonomy system, cross-referencing with established pharmacopoeias and reputable botanical databases to ensure definitive identification and correct classification. Explanation. The scenario presents a challenge in maintaining accurate and verifiable records for homeobotanical preparations, specifically concerning the identification and classification of botanical ingredients. This is professionally challenging because misidentification can lead to the use of incorrect or potentially harmful substances, impacting client safety and the efficacy of treatments. Adherence to established classification systems is paramount for consistency, traceability, and regulatory compliance. The correct approach represents best professional practice because it ensures that all botanical ingredients are identified and classified according to a recognized, standardized system. This aligns with the principles of good manufacturing practice and the ethical obligation to provide safe and effective treatments. By using a universally accepted classification system, therapists can ensure that the botanical material used is precisely what is intended, facilitating accurate record-keeping, quality control, and communication with other practitioners or regulatory bodies. This systematic approach minimizes the risk of error and upholds the integrity of the therapeutic process. An incorrect approach that relies on anecdotal evidence or personal recognition without formal verification fails to meet the standards of professional practice. This poses a significant regulatory and ethical failure because it introduces an unacceptable level of subjectivity and potential for error. Without a standardized classification, it becomes impossible to verify the identity of the plant material, which is a fundamental requirement for quality control and client safety. This lack of verifiable identification can lead to the use of adulterated or mislabeled ingredients, potentially causing adverse reactions or rendering the treatment ineffective. Such a practice undermines the credibility of the therapist and the profession as a whole. Another incorrect approach that involves using a classification system not recognized or validated within the homeobotanical therapy framework is also professionally unacceptable. This represents a regulatory and ethical failure because it deviates from established best practices and may not provide the necessary level of detail or accuracy required for therapeutic use. While the intention might be to categorize plants, using an unverified or inappropriate system can lead to confusion, misinterpretation of therapeutic properties, and an inability to ensure the correct botanical species is being used. This compromises the ability to maintain consistent and reliable preparations. The professional decision-making process for similar situations should involve a commitment to using only validated and recognized botanical identification and classification systems. Therapists must prioritize accuracy, verifiability, and adherence to established standards. This includes consulting reputable botanical guides, herbarium records, and professional organizations that endorse specific classification methodologies. When in doubt about the identification or classification of a plant, a therapist should seek expert consultation or refrain from using the material until its identity can be definitively confirmed. This rigorous approach ensures client safety, treatment efficacy, and professional integrity. Question 7. Operational review demonstrates that a homeobotanical therapist is considering incorporating a traditional remedy for a specific ailment based on extensive ethnobotanical documentation from an indigenous community. The therapist needs to assess the validity and applicability of this traditional use, which approach best aligns with professional standards for evaluating such ethnobotanical information. Option A. Disregard the ethnobotanical information entirely, as it is not derived from Western scientific methodologies and therefore lacks credibility. Option B. Systematically research peer-reviewed scientific literature, ethnobotanical databases, and consult with experts to corroborate the traditional claims and assess safety and efficacy. Option C. Immediately adopt the remedy into practice, assuming the indigenous community's long-standing use guarantees its effectiveness and safety. Option D. Rely solely on a single historical ethnobotanical text that mentions the plant, without seeking further contemporary scientific validation or considering potential contraindications. Correct answer is B. Systematically research peer-reviewed scientific literature, ethnobotanical databases, and consult with experts to corroborate the traditional claims and assess safety and efficacy. Explanation. This scenario presents a professional challenge due to the inherent complexities of ethnobotanical knowledge, which often exists in oral traditions and may not be formally documented or scientifically validated. A homeobotanical therapist must navigate the ethical imperative to respect traditional knowledge while ensuring client safety and adhering to professional standards of practice. The challenge lies in assessing the efficacy and safety of plant-based remedies derived from ethnobotanical sources without compromising the integrity of the traditional knowledge or the well-being of the client. Careful judgment is required to balance the potential benefits of these remedies with the need for evidence-based practice and responsible therapeutic recommendations. The correct approach represents best professional practice because it prioritizes a systematic and evidence-informed evaluation of ethnobotanical claims. This involves consulting peer-reviewed literature, reputable ethnobotanical databases, and, where possible, engaging with recognized experts in the field. This method aligns with the ethical obligation to provide safe and effective care, ensuring that any recommendations are grounded in the best available knowledge, even when that knowledge is derived from traditional practices. It also respects the intellectual property and cultural heritage associated with ethnobotanical uses by seeking to understand and validate them through rigorous inquiry, rather than simply accepting them at face value or dismissing them outright. An incorrect approach that relies solely on anecdotal evidence from a single community without further verification fails to meet professional standards. This can lead to the dissemination of unsubstantiated claims and potentially harmful recommendations, as anecdotal evidence is prone to bias and lacks the rigor of scientific investigation. Ethically, this approach disrespects the client's right to informed consent, as they are not being provided with information based on a comprehensive assessment of risks and benefits. Another incorrect approach that involves immediately dismissing all ethnobotanical uses as unscientific and therefore irrelevant is also professionally and ethically flawed. This demonstrates a lack of cultural sensitivity and a failure to recognize the potential value of traditional knowledge systems. Ethically, it can alienate clients who hold these traditions in high regard and may prevent the discovery of valuable therapeutic agents. It also fails to engage with the broader field of ethnobotany, which can inform and enrich homeopathic practice. A further incorrect approach that involves promoting a specific ethnobotanical remedy based on a single historical text, without considering contemporary scientific research or potential contraindications, is also unacceptable. This overlooks the dynamic nature of scientific understanding and the importance of ongoing research. Ethically, it exposes the client to potential risks by failing to account for modern pharmacological knowledge, drug interactions, or individual patient factors. The professional decision-making process for similar situations should involve a multifaceted approach. First, identifying the source and nature of the ethnobotanical information. Second, conducting a thorough literature search for scientific validation and safety data. Third, assessing the potential risks and benefits in the context of the individual client's health status and other treatments. And fourth, making informed recommendations that are both respectful of traditional knowledge and grounded in current scientific understanding and ethical practice. Question 8. System analysis indicates that a client diagnosed with type 2 diabetes, currently managed with prescribed metformin and regular blood glucose monitoring, is seeking homeobotanical therapy to complement their existing treatment. Which of the following approaches best reflects professional best practice for a homeobotanical therapist in this situation? Option A suggests that homeobotanical therapy is not suitable for chronic conditions like diabetes and decline to offer any services, redirecting the client to their physician for all management. Option B recommends specific homeobotanical remedies known for their potential to support blood sugar regulation, while advising the client to continue their prescribed medication and informing their physician about the homeobotanical consultation. Option C advise the client to discontinue metformin and rely solely on a comprehensive homeobotanical regimen for managing their diabetes, as this is often perceived as a more natural approach. Option D provide homeobotanical recommendations without inquiring about or acknowledging the client's current medical treatment, assuming the client will manage their medications independently. The correct answer is B. Recommend specific homeobotanical remedies known for their potential to support blood sugar regulation, while advising the client to continue their prescribed medication and informing their physician about the homeobotanical consultation. Explanation: this scenario presents a professional challenge due to the inherent complexity of managing chronic diseases with homeobotanical therapies. Homeobotanical therapists operate within a framework that requires them to balance the potential benefits of natural remedies with the established medical understanding of chronic conditions. The challenge lies in ensuring that therapeutic interventions are safe, effective, and do not contravene established health regulations or ethical guidelines for practitioners. Careful judgment is required to integrate homeobotanical approaches with conventional medical advice, respecting the client's autonomy while prioritizing their well-being. The correct approach represents best professional practice because it emphasizes a holistic and collaborative model of care. This involves thoroughly assessing the client's condition, understanding their medical history, and consulting with their primary healthcare provider. This collaborative stance ensures that homeobotanical interventions are complementary rather than contradictory to conventional treatment, thereby minimizing risks and maximizing potential benefits. It aligns with ethical principles of beneficence and non-maleficence, ensuring that the client receives comprehensive and safe care. Furthermore, it respects the regulatory framework by acknowledging the boundaries of homeobotanical practice and the importance of integrating with mainstream healthcare. An incorrect approach that involves solely relying on homeobotanical remedies without consulting the client's physician fails to adhere to best practices. This failure constitutes a significant ethical lapse by potentially undermining the client's conventional medical management and could lead to adverse interactions or delayed effective treatment. From a regulatory perspective, such an approach might be seen as practicing outside the scope of homeobotanical therapy, especially if it leads to negative health outcomes for the client. Another incorrect approach, which is to dismiss the client's conventional medical treatments in favor of homeobotanical alternatives, is ethically indefensible and potentially illegal. This directly violates the principle of non-maleficence by actively discouraging evidence-based medical care that is crucial for managing chronic diseases. It also disregards the client's right to informed consent regarding their overall healthcare plan. Such actions could lead to severe health deterioration and expose the therapist to professional sanctions and legal repercussions for providing unqualified medical advice. The professional decision-making process for similar situations should involve a multifaceted evaluation. Firstly, a thorough understanding of the client's current health status and all ongoing medical treatments is paramount. Secondly, open and honest communication with the client about the scope and limitations of homeobotanical therapy is essential. Thirdly, a commitment to collaboration with the client's medical doctor or specialist is a non-negotiable step. This ensures a coordinated care plan that prioritizes the client's safety and well-being, adhering to both ethical standards and the regulatory framework governing homeobotanical practice. Question 9. The assessment process reveals a patient presenting with persistent fatigue, digestive upset, and a history of anxiety, reporting that their emotional state significantly impacts their physical symptoms. The homeobotanical therapist is considering a treatment plan. Which of the following actions best aligns with the regulatory framework and ethical guidelines for a homeobotanical therapist? Option A. Prescribe a combination of homeobotanical remedies and suggest over-the-counter anxiety medications to manage the patient's emotional distress. Option B. Develop a homeobotanical treatment plan addressing the physical symptoms and acknowledging the impact of emotional well-being, while also advising the patient to consult their general practitioner for a comprehensive medical evaluation to rule out underlying conditions and discuss the anxiety. Option C. Provide a detailed diagnosis of the patient's anxiety and recommend a specific course of psychological therapy, as the emotional component is clearly dominant. Option D. Focus solely on the physical symptoms of fatigue and digestive upset with homeobotanical remedies, as anxiety falls outside the scope of a homeobotanical therapist's practice. The correct answer is B. Develop a homeobotanical treatment plan addressing the physical symptoms and acknowledging the impact of emotional well-being, while also advising the patient to consult their general practitioner for a comprehensive medical evaluation to rule out underlying conditions and discuss the anxiety. Explanation. The assessment process reveals a patient presenting with a complex interplay of physical symptoms and significant emotional distress, which are common in holistic practice. The professional challenge lies in discerning the appropriate scope of practice for a homeobotanical therapist, particularly when symptoms may overlap with those requiring referral to conventional medical practitioners or other regulated health professionals. Adhering strictly to the homeobotanical therapist certification regulatory framework is paramount to ensure patient safety and maintain professional integrity. The correct approach prioritizes a thorough, holistic assessment that acknowledges the patient's emotional state as integral to their overall well-being, while simultaneously recognizing the limitations of the homeobotanical therapist's scope of practice. This involves gathering comprehensive information about the patient's history, current symptoms, lifestyle, and emotional state, and then formulating a treatment plan that utilizes homeobotanical remedies within the defined scope. Crucially, it includes identifying red flags or symptoms that necessitate referral to a medical doctor or other appropriate healthcare professional, as mandated by ethical guidelines and regulatory requirements for patient safety. This approach upholds the principle of do no harm by ensuring that patients receive appropriate care, whether from the homeobotanical therapist or through referral. An incorrect approach would involve the homeobotanical therapist attempting to diagnose or treat conditions that fall outside their scope of practice, such as prescribing pharmaceutical medications or offering psychological therapy without appropriate qualifications and registration. This constitutes a breach of regulatory framework and ethical guidelines, potentially leading to patient harm and professional misconduct. Another incorrect approach would be to ignore or downplay the patient's emotional distress, treating it as secondary to physical symptoms. This fails to embrace the holistic principles of homeobotanical therapy and can lead to an incomplete and ineffective treatment plan, potentially exacerbating the patient's overall suffering. Furthermore, failing to recognize and act upon symptoms requiring conventional medical intervention represents a significant ethical and regulatory failure, jeopardizing patient safety. Professional decision-making in such situations requires a systematic approach. First, conduct a comprehensive assessment to understand the full picture of the patient's health. Second, evaluate the findings against the established scope of practice for a homeobotanical therapist. Third, identify any symptoms or conditions that fall outside this scope and require referral. Fourth, develop a treatment plan that is within scope and addresses the patient's needs holistically, including their emotional well-being. Finally, maintain clear and accurate records of the assessment, treatment plan, and any referrals made. Question 10. The performance metrics show a recurring issue where clients report a diminished and short-lived therapeutic effect from a specific homeobotanical complex. As the homeobotanical therapist responsible for its formulation, which of the following approaches best addresses this concern while adhering to professional standards? Option A. Immediately increase the concentration of the most frequently mentioned botanicals in the complex, assuming this will enhance potency and duration of effect. Option B. Replicate formulation techniques used in unrelated herbal preparations, as these are often perceived as more potent by the general public. Option C. Systematically review the entire formulation process, from botanical sourcing and extraction methods to the specific potentization techniques and the rationale for the chosen botanical synergy, consulting relevant homeobotanical literature for potential adjustments. Option D. Rely solely on the anecdotal feedback from the dissatisfied clients to make ad hoc changes to the remedy, without further investigation into the underlying formulation principles. The correct answer is C. Systematically review the entire formulation process, from botanical sourcing and extraction methods to the specific potentization techniques and the rationale for the chosen botanical synergy, consulting relevant homeobotanical literature for potential adjustments. Explanation. The performance metrics show a consistent trend of client dissatisfaction with the potency and duration of effect for a specific homeobotanical remedy. This scenario is professionally challenging because it requires a homeobotanical therapist to critically evaluate their formulation techniques without compromising client safety or adhering to unsubstantiated practices. The therapist must balance empirical observation with established principles of homeobotanical formulation, ensuring that any adjustments are evidence-informed and ethically sound within the scope of their practice. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based review of the formulation process. This involves a thorough examination of the raw materials, extraction methods, potentization techniques, and the rationale behind the chosen combination of botanicals. By consulting established literature and potentially seeking peer review, the therapist demonstrates a commitment to continuous learning and quality improvement, aligning with the ethical obligation to provide competent and effective care. This methodical approach ensures that any modifications are deliberate, justifiable, and aimed at improving therapeutic outcomes while maintaining the integrity of the remedy. An incorrect approach that involves arbitrarily increasing the concentration of certain botanicals without understanding the synergistic or antagonistic effects, or the principles of homeobotanical dilution and succussion, is ethically and professionally unacceptable. This could lead to an imbalance in the remedy, potentially causing adverse effects or rendering it ineffective. Another incorrect approach, such as relying solely on anecdotal client feedback without a systematic investigation into the underlying causes of dissatisfaction, fails to uphold the therapist's responsibility to apply a reasoned and informed approach to practice. Furthermore, adopting formulation techniques from unrelated disciplines or unverified sources without rigorous assessment would violate the principle of practicing within one's defined scope and adhering to established homeobotanical guidelines. Professionals should employ a decision-making framework that begins with clearly defining the problem, client dissatisfaction with remedy efficacy. This is followed by information gathering, reviewing formulation records, relevant literature, and client case notes. Next, potential solutions are generated, exploring alternative extraction methods, different potentization scales, or revised botanical combinations. These solutions are then evaluated based on established homeobotanical principles, safety considerations, and potential efficacy. Finally, the chosen solution is implemented and monitored for effectiveness, with a feedback loop for further refinement. Question 11. The risk matrix shows a client presenting with chronic fatigue and a history of mild hypertension, who is seeking a homeobotanical approach. The client has read online about the energizing properties of a specific herb and is convinced it will resolve their fatigue, despite no direct scientific evidence linking its primary constituents to the management of chronic fatigue in individuals with hypertension. As a homeobotanical therapist, how should you best address this situation, considering the role of plant constituents in healing and your professional responsibilities? Option A. Discuss the known primary plant constituents of the herb the client is interested in, their general physiological effects, and potential interactions with hypertension, while exploring other botanicals with constituents more directly researched for chronic fatigue and safety in hypertensive individuals. Option B. Advise the client that their understanding of plant constituents is incorrect and that the herb they are interested in has no proven benefit for fatigue, suggesting they consult a medical doctor for their hypertension. Option C. Prescribe a complex blend of various herbs with broad-spectrum energizing properties, without detailing the specific constituents or their relevance to the client's hypertension, to cover all bases. Option D. Immediately recommend the herb the client is interested in, as their conviction is a strong indicator of its potential efficacy for them, and focus on general hydration and rest. The correct answer is A. Discuss the known primary plant constituents of the herb the client is interested in, their general physiological effects, and potential interactions with hypertension, while exploring other botanicals with constituents more directly researched for chronic fatigue and safety in hypertensive individuals. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a homeobotanical therapist to balance client-centered care with the need for evidence-based practice and adherence to regulatory guidelines. The client's personal beliefs and anecdotal experiences, while important to acknowledge, must be weighed against the established understanding of plant constituents and their therapeutic actions, as well as the limitations of current scientific research in the field of homeobotany. The therapist must navigate potential conflicts between client expectations and what can be ethically and scientifically supported, all while operating within the specific regulatory framework for homeobotanical therapists. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a holistic understanding of the client's condition and integrating knowledge of specific plant constituents with their known or hypothesized mechanisms of action. This approach involves a thorough assessment of the client's health status, consideration of potential interactions, and a commitment to providing information that is both scientifically grounded and relevant to the client's needs. It emphasizes the importance of ongoing research and the therapist's responsibility to stay informed about the evolving understanding of plant-based therapies, aligning with the ethical duty to provide competent and safe care, as outlined by the Homeobotanical Therapist Certification Guidelines. This approach respects the client's autonomy while ensuring that recommendations are based on the best available knowledge and within the scope of practice. Incorrect approaches analysis. One incorrect approach fails by solely relying on anecdotal evidence and client testimonials without critically evaluating the underlying mechanisms or potential contraindications. This disregards the regulatory requirement for therapists to base their practice on sound principles and to avoid making unsubstantiated claims, potentially leading to ineffective or harmful recommendations. Another incorrect approach errs by dismissing the client's personal experiences and preferences entirely, focusing only on a narrow interpretation of scientific literature that may not fully encompass the nuances of homeobotanical practice. This can alienate the client and fail to address their holistic needs, contravening the ethical principle of client-centered care. A further incorrect approach might involve recommending a broad spectrum of remedies without a clear understanding of the specific plant constituents and their targeted actions for the client's condition. This lacks the precision and individualized approach expected of a certified therapist and could lead to unintended side effects or a lack of efficacy, violating the duty of care. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive client assessment, including their health history, current symptoms, and personal beliefs. This is followed by a thorough review of relevant scientific literature and established homeobotanical principles concerning the identified condition and potential botanical interventions. The therapist must then critically evaluate the evidence, considering the known properties of specific plant constituents, their synergistic or antagonistic effects, and any documented safety concerns or contraindications. This informed understanding is then used to develop a personalized therapeutic plan, discussed transparently with the client, respecting their autonomy while ensuring the recommendations are safe, ethical, and aligned with the regulatory framework for homeobotanical therapists. Continuous learning and a commitment to evidence-informed practice are paramount. Question 12. System analysis indicates that a homeobotanical therapist is consulting with a client experiencing persistent fatigue and mild digestive discomfort. The therapist has identified several botanical preparations that may offer supportive benefits for general well-being and energy levels. The core challenge lies in accurately defining the scope of their practice in this situation. Which of the following best defines the appropriate scope of practice for a homeobotanical therapist in this scenario? Option A. Recommending supportive botanical preparations for general well-being and energy, while clearly advising the client to consult a medical doctor for diagnosis and management of persistent fatigue and digestive issues. Option B. Providing a detailed treatment plan that includes specific dosages and frequencies of botanical remedies, implying they are a substitute for conventional medical treatment for the client's symptoms. Option C. Diagnosing the client with a specific gastrointestinal disorder and prescribing a potent botanical tincture to cure the condition. Option D. Claiming that the recommended botanical preparations will definitively eliminate the client's fatigue and digestive discomfort within a week. The correct answer is A. Recommending supportive botanical preparations for general well-being and energy, while clearly advising the client to consult a medical doctor for diagnosis and management of persistent fatigue and digestive issues. Explanation. This scenario presents a professional challenge due to the inherent ambiguity in defining the precise boundaries of homeobotanical therapy within a regulated health landscape. Therapists must navigate the risk of overstepping into regulated medical practice without appropriate licensure or qualification, while still providing effective and ethical care. Careful judgment is required to distinguish between supportive botanical recommendations and prescriptive medical interventions. The correct approach represents best professional practice because it adheres strictly to the established scope of practice for a homeobotanical therapist as defined by the relevant regulatory framework. This involves focusing on the holistic well-being of the client, utilizing botanical knowledge for supportive purposes, and clearly communicating the limitations of the therapy. It prioritizes client safety by ensuring that any conditions requiring conventional medical diagnosis or treatment are referred to appropriate healthcare professionals, thereby upholding ethical obligations and regulatory compliance. An incorrect approach that suggests diagnosing or treating specific diseases using homeobotanical remedies without being a registered medical practitioner or licensed healthcare provider constitutes a significant regulatory and ethical failure. This directly violates the scope of practice, potentially engaging in the unauthorized practice of medicine, which carries legal penalties and endangers client safety. Another incorrect approach that involves making definitive claims about the efficacy of homeobotanical remedies for curing serious illnesses without robust scientific evidence and within the bounds of the therapy's recognized applications, is also ethically problematic and potentially misleading to clients. This can lead to clients forgoing necessary conventional medical care, resulting in adverse health outcomes. A further incorrect approach that fails to disclose the limitations of homeobotanical therapy or its complementary nature to conventional medicine, thereby creating unrealistic expectations, is an ethical breach of informed consent and transparency. The professional decision-making process for similar situations should involve a clear understanding of the homeobotanical therapist's scope of practice, as outlined by the certification body and relevant legislation. Therapists must continuously assess whether their proposed interventions fall within these defined boundaries. When in doubt, seeking clarification from regulatory bodies or experienced mentors is crucial. A risk assessment should be performed, considering potential harm to the client, legal ramifications, and ethical considerations. Prioritizing client well-being and safety, maintaining transparency, and making appropriate referrals are paramount. Question 13. Process analysis reveals that a homeobotanical therapist is considering recommending a specific botanical for a client experiencing mild digestive discomfort. The therapist has encountered anecdotal reports suggesting its efficacy, and the botanical is commonly used in traditional practices for such issues. However, the therapist is also aware of ongoing research into its mechanisms of action and potential side effects. Considering the regulatory framework for homeobotanical therapist certification, which approach to recommending this botanical best aligns with professional standards and patient safety. Option A. Recommend the botanical, emphasizing its traditional use and anecdotal success, while advising the client to monitor for any adverse reactions. Option B. Recommend the botanical based solely on its widespread traditional use, without mentioning any scientific research or potential side effects, as this is a common practice. Option C. Advise the client against using the botanical, stating that without definitive, universally accepted scientific proof of efficacy for digestive discomfort, it is too risky to recommend. Option D. Recommend the botanical, citing the emerging scientific research on its potential benefits for digestive health and outlining any known contraindications or interactions based on current literature. The correct answer is A. Recommend the botanical, emphasizing its traditional use and anecdotal success, while advising the client to monitor for any adverse reactions. Explanation. Scenario analysis. This scenario presents a professional challenge because a homeobotanical therapist must navigate the complexities of recommending botanical remedies while adhering to the specific regulatory framework governing their practice. The challenge lies in distinguishing between established scientific evidence, traditional uses, and unsubstantiated claims, all within the bounds of what is legally permissible and ethically sound for a therapist. Misinterpreting or misrepresenting the efficacy or safety of a botanical can lead to patient harm and regulatory noncompliance. Correct approach analysis. The correct approach involves a thorough understanding of the homeobotanical therapist certification's regulatory framework, which likely emphasizes evidence-based practice and responsible therapeutic claims. This means prioritizing botanical recommendations supported by robust scientific research and clinical trials, while acknowledging and respecting traditional uses with appropriate caveats. The therapist must also be aware of any specific restrictions on claims related to disease treatment or prevention, ensuring that advice is framed within the scope of general well-being or symptom management, as permitted by regulations. This approach upholds professional integrity, patient safety, and legal compliance. Incorrect approaches analysis. One incorrect approach involves solely relying on anecdotal evidence or personal experience without corroborating scientific data. This fails to meet the regulatory standard for evidence-based practice and could lead to recommending ineffective or potentially harmful remedies. Ethically, it breaches the duty of care to the patient by not providing the most reliable and safe therapeutic options. Another incorrect approach is to make definitive claims about a botanical's ability to cure or treat specific diseases, especially if such claims are not supported by the regulatory bodies, guidelines, or recognized scientific consensus. This constitutes a misrepresentation of therapeutic potential, which is a direct violation of regulatory requirements and ethical practice, potentially leading to patient disappointment and harm if the remedy proves ineffective. A third incorrect approach is to ignore potential contraindications or drug interactions associated with a botanical remedy. Responsible practice, mandated by regulatory frameworks, requires a comprehensive understanding of a remedy's safety profile. Failing to consider these aspects can result in serious adverse health consequences for the patient, representing a significant ethical and regulatory failure. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive review of the Homeobotanical therapist certification's specific regulatory guidelines. This includes understanding the acceptable types of evidence for therapeutic claims and any limitations on what can be stated about botanical efficacy. When considering a botanical, the therapist should first search for peer-reviewed scientific literature and clinical studies. If traditional uses are being considered, these should be presented as such, with clear disclaimers about the level of scientific evidence. Any potential risks, contraindications, or interactions must be thoroughly investigated and communicated to the patient. The therapist's scope of practice, as defined by the certification, must always guide their recommendations and advice. Question 14. Process analysis reveals that a homeobotanical therapist is consulting with a new client who has been diagnosed with a chronic autoimmune condition and is currently undergoing conventional medical treatment. The client is seeking homeopathic support to complement their existing care. The therapist must determine the most appropriate course of action for remedy selection and client management. Which of the following approaches best aligns with regulatory compliance and ethical best practices for a homeobotanical therapist? Option A. Prescribe a remedy based on the specific autoimmune disease diagnosis, aiming to directly suppress the disease process as understood in conventional medicine. Option B. Focus solely on the client's physical symptoms related to the autoimmune condition, selecting a remedy based on these isolated physical complaints without delving into their mental or emotional state. Option C. Conduct a thorough case taking to elicit the client's unique totality of symptoms, considering their mental, emotional, and physical states, and select a remedy that matches this individual picture, while also advising the client to continue their conventional medical treatment. Option D. Recommend discontinuing conventional medical treatment in favor of a potent homeopathic remedy that the therapist believes can address the root cause of the autoimmune condition. The correct answer is A. Prescribe a remedy based on the specific autoimmune disease diagnosis, aiming to directly suppress the disease process as understood in conventional medicine. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a homeobotanical therapist to navigate the nuanced application of homeopathic principles within a framework that may be subject to evolving regulatory oversight and public perception. The therapist must balance the traditional understanding of remedy selection with the need for clear, evidence-informed communication and adherence to professional standards, particularly when dealing with conditions that have established conventional medical treatments. The challenge lies in providing effective, ethical, and compliant guidance without making unsubstantiated claims or misrepresenting the scope of practice. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient well-being and regulatory compliance. It involves a thorough understanding of the individual's health status, including any conventional diagnoses and treatments, and then applying homeopathic principles to select a remedy that addresses the patient's unique symptom picture. This approach acknowledges the limitations of homeopathic practice and emphasizes collaboration with conventional healthcare providers when necessary. It aligns with ethical guidelines that mandate honesty, competence, and the avoidance of harm. Specifically, it adheres to the principle of do no harm by not discouraging patients from seeking or continuing conventional medical care for serious conditions. It also upholds professional integrity by focusing on the individual's subjective experience and the holistic nature of homeopathic assessment, rather than making definitive claims about curing specific diseases. Incorrect approaches analysis. An incorrect approach would involve making definitive claims about curing specific diseases or conditions, especially those with serious prognoses or established conventional treatments. This is a regulatory and ethical failure because it constitutes unsubstantiated medical claims, which are prohibited. It misrepresents the scope of practice and can lead patients to abandon or delay necessary conventional medical care, thereby causing harm. Another incorrect approach would be to dismiss or disregard the patient's conventional medical diagnosis or treatment plan without consultation with their primary healthcare provider. This violates the ethical duty to collaborate and can undermine the patient's overall healthcare. Furthermore, an incorrect approach would be to select a remedy based solely on a disease name rather than the totality of the patient's individual symptoms, which is contrary to fundamental homeopathic principles and can lead to ineffective treatment. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive case intake that includes understanding the patient's medical history, current conventional treatments, and their subjective experience of symptoms. They should then apply their knowledge of homeopathic principles to identify a remedy that matches the individual's unique symptom profile. Crucially, they must maintain open communication with the patient about the nature of homeopathic treatment, its limitations, and the importance of ongoing conventional medical care. Decision-making should be guided by a commitment to patient safety, ethical practice, and adherence to all relevant professional guidelines and regulations governing complementary and alternative medicine practitioners. When in doubt, seeking consultation with experienced colleagues or regulatory bodies is advisable. Question 15. The control framework reveals that a homeobotanical therapist is consulting with a client who has a mild inflammatory condition. The therapist is considering recommending a specific botanical remedy known for its anti-inflammatory properties. To ensure the most effective and safest approach, which of the following best guides the therapist's decision-making regarding the plant's phytochemistry? Option A. Relying solely on anecdotal evidence of the plant's traditional use for inflammation, assuming its efficacy is well established. Option B. Focusing on the most abundant compound in the plant, assuming it is the primary driver of therapeutic effects and disregarding other constituents. Option C. Prioritizing an understanding of the specific active compounds responsible for the anti-inflammatory action, their known mechanisms, and potential interactions with other substances. Option D. Assuming that all compounds present in the plant are beneficial and contribute positively to the inflammatory condition. The correct answer is C. Prioritizing an understanding of the specific active compounds responsible for the anti-inflammatory action, their known mechanisms, and potential interactions with other substances. Explanation. The control framework reveals that a homeobotanical therapist must possess a thorough understanding of phytochemistry to ensure client safety and efficacy of treatments. This scenario is professionally challenging because it requires the therapist to move beyond general knowledge of plant properties and delve into the specific active compounds responsible for therapeutic effects, as well as potential interactions and contraindications. Accurate identification and understanding of these compounds are paramount for responsible practice. The correct approach represents best professional practice because it prioritizes evidence-based understanding of the plant's active constituents and their known pharmacological actions. This aligns with the ethical obligation to provide safe and effective care, grounded in scientific principles relevant to phytochemistry. By focusing on the specific active compounds, the therapist can assess potential synergistic or antagonistic effects with other remedies or medications, identify potential toxicity, and tailor recommendations based on the precise biochemical mechanisms of action. This demonstrates a commitment to a high standard of professional competence and client well-being, as expected within the regulatory framework for homeobotanical therapists. An incorrect approach that relies solely on traditional uses without investigating the underlying phytochemistry fails to meet the standard of care. This can lead to misapplication of remedies, potential adverse reactions due to unacknowledged active compounds, or ineffective treatment if the traditional use is not supported by the plant's chemical profile. Ethically, this represents a failure to exercise due diligence and a potential breach of the duty of care owed to the client. Another incorrect approach that focuses on a single, well-known active compound while ignoring others present in the plant is also professionally unacceptable. Plants are complex matrices, and multiple compounds can contribute to the overall therapeutic effect or introduce unforeseen interactions. Overlooking these can lead to an incomplete understanding of the remedy's potential impact, risking both efficacy and safety. This demonstrates a superficial understanding of phytochemistry and a failure to conduct a comprehensive assessment. A further incorrect approach that assumes all compounds within a plant are beneficial or inert is a significant regulatory and ethical failure. This demonstrates a lack of critical thinking and a disregard for the potential for toxicity or adverse effects from various phytochemicals. Responsible practice demands a nuanced understanding that acknowledges both the therapeutic potential and the inherent risks associated with plant compounds. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the plant and its traditional uses. 2. Research the established phytochemistry of the plant, focusing on key active compounds and their known pharmacological actions. 3. Assess potential interactions with the client's existing medications, supplements, or health conditions based on the identified active compounds. 4. Consider the concentration and bioavailability of active compounds, if information is available. 5. Evaluate the scientific literature for evidence supporting the efficacy and safety of the plant and its active compounds for the client's specific needs. 6. Document all findings and the rationale for treatment recommendations. Question 16. The assessment process reveals a client presenting with chronic fatigue, characterized by a general lack of vitality, feeling cold, and a desire for warmth. The therapist is considering a homeobotanical preparation known for its warming and vitalizing properties. Which of the following best describes the primary mechanism of action to consider within the framework of homeobotanical therapy for this client? Option A. The preparation's ability to stimulate the body's inherent vital force, thereby addressing the underlying lack of energy and constitutional coldness. Option B. The preparation's proven efficacy in clinical trials for reducing fatigue symptoms by targeting specific neurotransmitter pathways. Option C. The preparation's capacity to act as an adaptogen, buffering the body against physiological stress through known phytochemical interactions. Option D. The preparation's documented effect on increasing cellular metabolism through specific biochemical compounds. The correct answer is A. The preparation's ability to stimulate the body's inherent vital force, thereby addressing the underlying lack of energy and constitutional coldness. Explanation. The assessment process reveals a common challenge in homeobotanical therapy, discerning the most effective mechanism of action for a given condition based on limited, often anecdotal, evidence. Professionals must navigate the inherent complexities of individual responses and the subtle interactions between botanical preparations and the body's vital force. This scenario is professionally challenging because it requires a therapist to move beyond simple symptom matching and engage in a deeper understanding of the underlying principles of homeobotanical action, while remaining within the bounds of ethical practice and regulatory guidelines for certified therapists. The correct approach represents best professional practice because it prioritizes a holistic understanding of the individual and the preparation's energetic signature, aligning with the core tenets of homeobotanical therapy as understood within its specific regulatory framework. This involves considering the totality of the patient's symptoms, their constitutional makeup, and the specific properties of the chosen botanical preparation, aiming to stimulate the body's inherent healing capacity. This approach is ethically sound as it places the patient's well-being and individualized care at the forefront, respecting the unique nature of each therapeutic encounter. An incorrect approach that focuses solely on the biochemical constituents of a botanical preparation fails to acknowledge the energetic and vitalistic principles central to homeobotanical therapy. This represents a regulatory failure by misinterpreting the scope of practice for a homeobotanical therapist, which is not equivalent to that of a pharmacologist or conventional herbalist focused on isolated compounds. Ethically, it risks oversimplifying complex interactions and potentially leading to inappropriate prescribing based on a reductionist view. Another incorrect approach that relies exclusively on established scientific research for isolated botanical compounds is also problematic. While scientific evidence is valuable, homeobotanical therapy often operates in areas where such evidence is nascent or non-existent for specific preparations or potencies. Adhering strictly to this would limit the therapeutic scope and ignore the empirical wisdom and individualized application that defines the practice. This could be seen as a regulatory failure if it implies that only scientifically validated interventions are permissible, thereby exceeding the established scope of homeobotanical practice. Ethically, it may lead to a therapist withholding potentially beneficial treatments due to a lack of conventional scientific validation, failing to serve the patient's needs within the accepted framework of their practice. The professional decision-making process for similar situations should involve a thorough case intake, a deep understanding of homeobotanical principles, including vital force, energetic signatures, and individualization, careful consideration of the patient's unique presentation, and the selection of preparations based on a holistic assessment, rather than solely on isolated biochemical actions or limited scientific studies. It requires continuous learning and adherence to the ethical code and regulatory guidelines specific to homeobotanical therapy certification. Question 17. The control framework reveals that a homeobotanical therapist is assessing a new patient presenting with chronic fatigue and a persistent cough. The patient also reports significant anxiety, particularly in social situations, and a strong aversion to cold, damp weather. When considering the patient's constitutional type, which of the following approaches best aligns with the principles of individualized homeopathic prescribing as expected within the regulatory guidelines? Option A. Recommending a remedy that is commonly indicated for anxiety, focusing solely on the patient's reported social anxieties. Option B. Selecting a remedy that covers the totality of the patient's symptoms, including their mental, emotional, and physical complaints, as well as their characteristic modalities and aversions, to identify the underlying constitutional picture. Option C. Prescribing a remedy based on the most prominent physical symptom, the chronic fatigue, without further inquiry into the patient's mental or emotional state. Option D. Suggesting a remedy based on the patient's expressed preference for a particular homeopathic remedy they have read about, without conducting a full case analysis. The correct answer is C. Prescribing a remedy based on the most prominent physical symptom, the chronic fatigue, without further inquiry into the patient's mental or emotional state. Explanation. The control framework reveals that a homeobotanical therapist's practice is governed by specific guidelines that emphasize accurate assessment and appropriate application of therapeutic principles. In the context of constitutional types in homeopathy, a therapist faces the professional challenge of moving beyond superficial symptom presentation to identify the underlying constitutional picture of the patient. This requires deep understanding, careful observation, and the ability to differentiate between acute, temporary states and the patient's fundamental, long-term disposition. Misinterpreting a constitutional type can lead to ineffective treatment, prolonged suffering, and a breach of professional duty to provide competent care. The correct approach represents best professional practice because it aligns with the core tenets of homeopathic philosophy and the ethical obligation to individualize treatment. By considering the totality of the patient's symptoms, including mental, emotional, and physical characteristics, and understanding how these manifest in relation to their inherent constitution, the therapist can select a remedy that addresses the root cause of imbalance. This holistic and individualized approach is fundamental to effective homeopathic practice and is implicitly supported by the regulatory framework's expectation of competent and ethical service delivery. An incorrect approach that focuses solely on a single prominent physical symptom, such as a skin rash, without considering the patient's broader mental and emotional state or their characteristic reactions to environmental factors, fails to grasp the essence of constitutional prescribing. This approach risks treating a mere symptom rather than the whole person, leading to superficial or temporary relief at best, and potentially masking deeper issues. Ethically, this constitutes a failure to provide adequate care and a deviation from the principles of individualized medicine. Another incorrect approach that relies on generalized, cookbook-style prescribing based on broad categories of constitutional types without a thorough case-taking process is also professionally unacceptable. This method bypasses the crucial step of individualization, which is the hallmark of homeopathy. It can lead to prescribing remedies that are not well suited to the patient's unique presentation, thereby failing to achieve therapeutic goals and potentially causing harm through inappropriate intervention. This demonstrates a lack of due diligence and a disregard for the patient's specific needs. A further incorrect approach that prioritizes the patient's immediate demands or preferences for a particular remedy over a comprehensive constitutional assessment is ethically problematic. While patient autonomy is important, the therapist's professional responsibility is to guide the patient towards the most appropriate treatment based on their expertise and the principles of homeopathy. Uncritically accepting a patient's self-diagnosis or remedy preference without a thorough evaluation can lead to suboptimal outcomes and undermines the therapist's role as a trusted advisor. The professional decision-making process for similar situations should involve a structured case-taking methodology that systematically gathers information across all levels of the patient's being. This includes detailed inquiry into mental and emotional states, general modalities, what makes symptoms better or worse, physical symptoms, and the patient's overall vitality and disposition. The therapist must then synthesize this information to discern the most characteristic and peculiar symptoms that point towards the patient's constitutional type. This analytical process, guided by homeopathic principles and ethical considerations, ensures that treatment is both accurate and effective. Question 18. Assessment of a 45-year-old client presenting with chronic eczema, recurring urinary tract infections, and a deep-seated feeling of insecurity and suspicion towards others. The client reports a family history of venereal disease and a personal history of early childhood trauma. The homeobotanical therapist is considering the miasmatic influences at play. Which of the following approaches best reflects a comprehensive understanding of miasms and their role in this client's disease, in accordance with homeobotanical principles? Option A. Recognizing the interplay of psora, eczema, insecurity, psychosis, urinary tract infections, and syphilis family history, suspicion, as contributing layers to the client's disease, and formulating a treatment plan that addresses these miasmatic influences holistically. Option B. Focusing solely on the presenting physical symptoms of eczema and urinary tract infections, and selecting remedies based on their known efficacy for these conditions, without considering miasmatic theory. Option C. Identifying the dominant miasm as psora due to the chronic eczema and insecurity, and prescribing remedies aimed at alleviating these specific symptoms. Option D. Diagnosing syphilis as the primary miasm due to the suspicion and family history, and prescribing remedies that target this specific miasm, disregarding other presenting symptoms. The correct answer is C. Identifying the dominant miasm as psora due to the chronic eczema and insecurity, and prescribing remedies aimed at alleviating these specific symptoms. Explanation. This scenario presents a professional challenge due to the nuanced and often subjective nature of miasmatic diagnosis within homeobotanical practice. The therapist must balance the client's subjective experience with the theoretical framework of miasms, ensuring that their approach is both therapeutically effective and ethically sound, adhering strictly to the homeobotanical therapist certification guidelines. Careful judgment is required to avoid oversimplification or misapplication of miasmatic theory, which could lead to inappropriate treatment or a failure to address the root cause of the client's disease. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment, integrating the client's presenting symptoms with a deep understanding of miasmatic influences as understood within the homeobotanical framework. This approach acknowledges that miasms are not isolated entities, but rather underlying predispositions that manifest in complex ways. By considering the totality of the client's state, including their physical, mental, and emotional aspects, and then correlating these with the characteristic expressions of the primary miasms, psora, psychosis, syphilis, the therapist can formulate a more accurate and effective treatment plan. This aligns with the ethical imperative to provide client-centered care and to practice within the scope of homeobotanical knowledge. An incorrect approach that focuses solely on a single, dominant miasm without considering the interplay of others would be a regulatory and ethical failure. It risks oversimplifying the client's condition, potentially leading to a superficial treatment that fails to address the deeper, underlying miasmatic burden. This could be seen as a failure to exercise due diligence and professional competence as expected of a certified homeobotanical therapist. Another incorrect approach, which dismisses miasmatic theory entirely in favor of purely symptomatic treatment, would also be a failure. It disregards a core principle of homeobotanical practice, potentially limiting the therapist's ability to achieve profound and lasting healing, and failing to uphold the standards of the certification. A third incorrect approach, which attempts to diagnose miasms based on superficial or transient symptoms without a thorough case staking, would be ethically problematic as it could lead to misdiagnosis and inappropriate remedies, potentially harming the client and undermining the credibility of the profession. The professional decision-making process for similar situations should involve a systematic and thorough case staking, meticulously documenting all aspects of the client's health history and current state. This should be followed by a careful analysis of the collected information, looking for patterns and characteristic expressions that align with the established understanding of miasmatic influences within homeobotanical theory. The therapist must then critically evaluate the potential miasmatic layers, recognizing that multiple miasms often coexist and interact. Treatment decisions should be based on this comprehensive understanding, always prioritizing the client's well-being and aiming for a deep, constitutional healing rather than merely suppressing symptoms. Continuous professional development and consultation with experienced practitioners are also vital for refining diagnostic skills and ensuring adherence to best practices. Question 19. Comparative studies suggest that the efficacy of homeobotanical preparations can be significantly influenced by the chosen extraction method. Considering the regulatory framework for homeobotanical therapist certification, which of the following approaches best aligns with the principles of preparing tinctures, infusions, and decoctions for optimal therapeutic benefit and compliance? Option A. Relying solely on anecdotal evidence and personal preference when deciding between tinctures, infusions, and decoctions, without reference to specific botanical properties or established extraction guidelines. Option B. Selecting the extraction method, tincture, infusion, or decoction, based on the specific plant part being used, e.g., roots and barks for decoctions, leaves and flowers for infusions, and a broader range for tinctures, and the desired solvent, as guided by established homeobotanical principles and certification standards. Option C. Employing a rapid boiling method for all plant materials to expedite the extraction process and maximize the immediate release of constituents, assuming this leads to a more potent final product. Option D. Consistently using a single extraction method, such as a cold maceration tincture, for all plant materials to ensure uniformity and simplify the preparation process, regardless of the plant's characteristics. The correct answer is B. Selecting the extraction method, tincture, infusion, or decoction, based on the specific plant part being used, e.g., roots and barks for decoctions, leaves and flowers for infusions, and a broader range for tinctures, and the desired solvent, as guided by established homeobotanical principles and certification standards. Explanation. This scenario presents a professional challenge in accurately applying extraction methods for homeobotanical preparations, while adhering to the specific regulatory framework for homeobotanical therapist certification. The challenge lies in understanding the nuances of each method, tinctures, infusions, decoctions, and their suitability based on the plant material's properties and the desired therapeutic outcome, all within the bounds of established guidelines. Careful judgment is required to ensure efficacy, safety, and compliance. The correct approach represents best professional practice because it demonstrates a thorough understanding of the principles of homeobotanical extraction as outlined by the Homeobotanical Therapist Certification Guidelines. This involves selecting the most appropriate method based on the plant part, e.g., leaves, flowers, roots, bark, and its constituents, ensuring optimal extraction of active compounds while minimizing degradation. Adherence to these guidelines ensures that the therapist is providing safe and effective preparations, upholding the integrity of the practice, and meeting the standards expected for certification. An incorrect approach that suggests using a single extraction method for all plant materials, regardless of their characteristics, represents a significant regulatory and ethical failure. This would violate the principle of evidence-based practice and potentially lead to suboptimal or even harmful preparations. For instance, using an infusion for woody roots would likely result in poor extraction of beneficial compounds, failing to meet the therapeutic intent. Conversely, using a decoction for delicate flowers could degrade volatile oils and other sensitive constituents, rendering the preparation less effective and potentially altering its safety profile. Such a failure indicates a lack of understanding of fundamental homeobotanical principles and a disregard for the guidelines designed to protect client well-being. Another incorrect approach might involve prioritizing speed of preparation over the scientific basis of extraction. This could lead to rushed processes that do not allow for adequate extraction time or temperature control, compromising the quality and potency of the final product. This is a regulatory failure as it deviates from established best practices for extraction, which are implicitly or explicitly part of the certification requirements. Ethically, it is a failure to provide the best possible care to the client. The professional decision-making process for similar situations should involve a systematic evaluation of the plant material, considering its botanical classification, the part of the plant being used, and the known properties of its constituents. This evaluation should then be cross-referenced with the established guidelines and best practices for tinctures, infusions, and decoctions, as taught within the Homeobotanical Therapist Certification Framework. The therapist must ask, which method will best preserve the therapeutic properties of this specific plant material while ensuring safety and efficacy according to our regulatory standards? This analytical approach, grounded in the specific curriculum and ethical codes of the certification, ensures that decisions are not arbitrary, but are based on sound principles and regulatory compliance. Question 20. Strategic planning requires a homeobotanical therapist to consider how their recommendations will interact with a client's established conventional medical treatment for a chronic condition. A client presents with a recent diagnosis of hypertension and is prescribed medication by their general practitioner. The client expresses a desire to use homeobotanical remedies to support their overall well-being and manage stress, which they believe contributes to their blood pressure. What is the most responsible and ethically sound course of action for the homeobotanical therapist? Option A. Recommend specific homeobotanical remedies for blood pressure regulation, emphasizing their natural properties, and advise the client to monitor their blood pressure closely. Option B. Suggest the client discontinue their prescribed medication if they feel it is not working effectively and rely solely on homeobotanical approaches for managing their hypertension. Option C. Advise the client to inform their general practitioner about their interest in homeobotanical support and seek their consent before proceeding with any recommendations, while also clearly explaining the supportive, non-curative role of homeobotanical therapy. Option D. Proceed with recommending stress-reducing homeobotanical remedies without mentioning the client's hypertension or conventional medication, as the focus is on stress management. The correct answer is C. Advise the client to inform their general practitioner about their interest in homeobotanical support and seek their consent before proceeding with any recommendations, while also clearly explaining the supportive, non-curative role of homeobotanical therapy. Explanation. This scenario presents a common challenge for homeobotanical therapists, navigating the integration of their practice with conventional medical approaches. The core difficulty lies in respecting the patient's autonomy and existing medical care while offering complementary support. A homeobotanical therapist must operate within their scope of practice, which typically does not include diagnosing or treating medical conditions, but rather supporting overall well-being and physiological balance through botanical preparations. The correct approach prioritizes patient safety and informed consent by ensuring open communication with the patient's conventional medical provider. This collaborative stance respects the established medical diagnosis and treatment plan, preventing potential contraindications or interference with prescribed therapies. It aligns with ethical principles of non-maleficence, do no harm, and beneficence, acting in the patient's best interest by seeking to understand the full picture of the patient's health management. Regulatory frameworks for complementary and alternative medicine practitioners often emphasize the importance of not undermining conventional medical care and of referring patients to qualified medical professionals when necessary. Incorrect approaches fail to uphold these critical standards. One incorrect approach might involve directly advising the patient to alter or discontinue their conventional medication without consulting the prescribing physician. This is a significant ethical and potentially legal violation, as it oversteps the homeobotanical therapist's scope of practice and could lead to serious adverse health consequences for the patient. It directly contravenes the principle of respecting the established medical treatment plan and could be seen as practicing medicine without a license. Another incorrect approach might be to proceed with recommending homeobotanical remedies without any acknowledgement or discussion of the patient's conventional treatment. This lack of communication creates a risk of interactions between the botanical preparations and prescribed medications, potentially leading to reduced efficacy of either or adverse effects. It also fails to demonstrate due diligence in understanding the patient's overall health status and the context of their medical care, which is a fundamental aspect of responsible practice. The professional decision-making process in such situations should involve 1. Thoroughly understanding the patient's current medical diagnosis and treatment plan. 2. Openly discussing the patient's desire for homeobotanical support and how it might complement, not replace, their conventional care. 3. Obtaining explicit consent from the patient to communicate with their conventional medical provider. 4. Collaborating with the conventional medical provider to ensure the safety and efficacy of the combined approach. 5. Clearly defining the scope of the homeobotanical therapy, focusing on supportive measures rather than disease treatment. 6. Continuously monitoring the patient for any adverse reactions or changes in their condition, and being prepared to refer back to conventional medicine as needed.